Hi, I'm Dr. Rhea Hogseth, founder and director of the Pediatric Dental Assistants Association. So no matter what business you're in, if you deal with kids, you have to deal with behavioral issues. So what do you do in your office if you have a wild, unruly child in your reception area? They're running around, jumping off chairs, they're playing tag with other children in the area. So what do you do? There is no one single answer for that. The concerns are numerous. One, we're worried about the safety of that child. Two, we're worried about the safety of the other children and the other parents in the reception area who also might be injured. It's also a quality of life issue for the other parents that are out there trying to have a moment of peace and quiet. They could also maybe damage some equipment. And besides all the injuries that might occur and the damage to the equipment, this is a huge insurance issue for your practice. So this is something you really need to decide how you're going to handle it. And that is going to be my suggestion to you. So have your entire team come together and role play. I know that's not always the most favorite way to do, but it can be quite fun. Have them come up with some of the most outrageous scenarios and figure out how you're going to handle it. And then when it comes to more of the everyday issues, it's easier to figure out what you want to do. Now obviously the first thing to do is maybe address the parent, right, of that child. So they might be distracted, they might be scrolling through their phone, they might be completely oblivious as to what's going on around them. And you and I both know that that's a very common scenario, right? So while nobody wants to tell a parent how to discipline their child or how to raise their child, it is important for you to maintain a safe environment in the office. So it's critical that you address the issue. So whether it's a ma'am or a sir, you could very kindly say that Johnny is running wildly through the office and misbehaving, and we really would like for you to ask him to stop. If you get any pushback from the parent, you can point out to them that it's for the safety of Johnny. We don't want to see him get hurt. We don't want him to hurt anybody else that's out in the reception area, and we absolutely don't want him to break any equipment. So if you address that with the parent, they're usually going to be much more compliant. But if you have that child who is just not willing to even do what his parent is asking, you might have to ask them to take the child outside and see if that will help calm down the child. Whatever you come up with for the scenarios, make sure everybody in the office understands what they are to do. And doctors, you need to empower them to be able to do that for you. You don't want them to have to come interrupt you while you are doing some restorative work to come out and address a crazy kid out in the reception area. Now this can happen back in your open bay, it can happen in your x-ray room, it can happen in the operatory. So come up with all those different scenarios. You as a team decide how you want to handle it. Doctors, empower them, stick behind your team. Because bottom line, running your pediatric dental office, you are to provide a safe, nurturing environment for everybody in that office. That includes your patients, their parents, your team, and the doctor. I'm Dr. Rhea Hogseth, founder and director of the Pediatric Dental Assistants Association. This is your practice pro from the PDAA, and I'll see you on the next one.